Hello to everyone connected from across the country to join the National Association of Latino Healthcare Executives in our premier launch of NALHE's Executive Speaker Series, charting a path to the 2021 Annual Leadership Summit. This year's summit is scheduled to be held September 22nd and 23rd virtually, and with carefully designed and safe opportunities to meet in person in the picturesque city of Denver, Colorado. This option will continue to be informed by local health authorities and data, but in the meantime, we welcome you to save the date. More information on the Leadership Summit will be live soon at our website, www.nalhe.org, and that's NALHE.org. My name is Rolando Gomez, and I am President and Board Chair of NALHE until March of this year, when I turn over leadership of this incredible association to Monica Vargas-Mahar joining us today. It gives me great pleasure to welcome you to session 1 of this series. We have the honor of hosting and are in great company of top executive leaders in our industry. Moderating the conversation is our very own DeAnna Caudillo, President of the Denver Metro Chapter of NALHE and Chair of the 2021 NALHE Annual Leadership Summit. Our guest speakers today are Don Mares, Executive Director of Denver Human Services, and Monica Vargas-Mahar, Chief Executive Officer of the Hospitals of Providence, and your incoming President and Board Chair of NALHE for 2021 and 2022. Thank you all for your time and insight. This session will explore further the leadership lens of executives in our field that are navigating the COVID-19 pandemic. I can't express enough how critical and valuable this conversation will be today. We will take a deep dive into the leadership perspectives during the challenging time, supporting staff, balancing financial portfolios, collaborating with the community, coordinating distribution of vaccinations, conducting advocacy, and much, much more. At NALHE, we are really proud and thankful to have multiple health industry partners and sponsors, such as the health systems represented today, Denver Human Services, and the Hospitals of Providence. I'd also like to take a moment to recognize our national sponsors for their generous contribution to bring to you events such as this. In these partnerships is a key to ensuring that together we work cross-market and cross-competitive boundaries and have core values and a unified priority to create inclusive opportunities. We welcome a connection with your organization to consider sponsoring future NALHE events. DeAnna, thank you for your servant leadership, multiple volunteer hours, and for designing and launching today's activities. So with that, I invite you to enjoy the conversation and wish to connect with you soon as a member of the NALHE family. DeAnna, the stage is yours.
Thank you so much, Rolando. Generous introduction. I appreciate that. So good morning to everyone. I would like to begin by introducing our two distinguished panelists who are graciously joining us this morning. Don Mares is the Executive Director of Denver Human Services, which provides support to 1 in 3 Denver residents to help them build and maintain overall well-being. Under his leadership, the department has spearheaded a multi-agency effort to strengthen the child safety net for kids in danger and improving the agency's outreach into communities with the formation of a new division focused on community outreach, engagement, and charitable giving. Don has also been actively involved in the behavioral health community, serving as past president and CEO of Mental Health Colorado, which is the state's preeminent behavioral health community organization, serving to work on advocacy and systems change. He has served in Governor Bill Ritter's cabinet as the executive director of the Colorado Department of Labor and Employment and was elected as Denver's auditor from 1995 to 2003. And served as a Colorado state senator and state representative from 1989 to 1995. He is a talented and generous leader who continues to give back to the state of Colorado, and it is my honor and privilege to have him join us today. Don, thank you so much and welcome.
Oh, I'm honored. Thank you.
Monica Vargas is the CEO of the Hospitals of Providence East Campus and Market Chief Operating Officer for the Hospitals of Providence Network in El Paso, Texas. Additionally, she is the incoming President and Board Chair of the National Association of Latino Healthcare Executives. Monica has more than 20 years of experience in the field of healthcare administration and has previously served as Chief Executive Officer for the Sierra campus, Chief Operating Officer for the Memorial Campus and Providence Children's Hospitals, as well as the Chief Operating Officer for the campus. Monica was born and raised in El Paso and received her master's degree in healthcare administration from Trinity University in San Antonio. She is a remarkable leader and a strong advocate for healthcare equity in the communities that she serves. Monica, thank you so much for joining us this morning and taking your time.
Thank you, DeAnna. Such a privilege to be with you all.
Yeah, you're welcome. So we'll just start off the panel discussion with looking at some of the different areas that have kind of arisen during this pandemic. So what are some of the areas that have arisen that were a little less obvious before the pandemic started, whether that was in areas of need or gaps in services or funding streams? So whoever wants to start us off, that would be wonderful.
Monica, you want to start us off?
Sure, thank you. So thank you for that generous introduction, and it's such a privilege to be here. And I am looking forward to this conversation because I think between the two of us, we'll offer a unique perspective. I being on the inpatient hospital traditional side, and Dawn really the work of doing community service. I think, you know, in general, I think we can all admit that we just didn't have much information at the beginning of this. We were learning as information was being discovered about the way to respond to a pandemic. So I think when you sort of set all that, you know, the things you didn't know about aside, perhaps the one thing that comes really on the top of my list that surprised many of us is the level of support, additional support, both on the spiritual, you know, mental health support side that our own employees needed. Our caregivers devote themselves to you know, it's a calling to serve. And so, you know, the hardships, the suffering is something that they certainly knew of before, but this was different. And I think it had both to do with the scale at which they were encountering these pressures, as well as just the added dynamics of not having family at the bedside. You know, that was tremendous. All of us across the country had to, for the necessary precautions to protect our caregivers as well as others, had to close and limit visitation. And, you know, the burden that our staff carried was immense and tremendous, that we perhaps at the beginning didn't foresee the magnitude that was going to have.
Boy, I'll tell you, Monica, hearing you answer that question makes me really appreciate how both what you do and what we do is at the front of this whole crisis that we're in. You know, we're at the front lines, whether it's the healthcare and services you provide or the desperate benefits the desperate need for benefits that people have. So really appreciate what you do. For us, a couple of the kind of aha experiences we had when this whole situation started was, number one, it really pointed out to us how much what we call agency time people who are in poverty or who are in need have to experience. What I mean by agency time is like waiting in lines or having to come to a department and you know, on our terms, if you will. That's how we used to do it, is, you know, people who need something come to us on our terms. And it really pointed out that that's not really the greatest situation, not only for their health in this pandemic, but just the time that it takes and the stress involved with, you know, schlepping people on buses and getting to a Department of Human Services. So I would say that was one of the biggest aha kind of experiences we had in the pandemic was, boy, this stuff is something that frankly we need to think about when this pandemic is over. How do we do business differently for their benefit? And the other one that's talked a lot about in not just human services work, but all over around this pandemic is the whole technology gap, if you will, and how sure, it was easy for us to send our employees home and we could address their technology needs as a city. But the question was, what about those clients of ours and their technology needs and limitations? So it really, again, sort of really pointed out to us that we had to address that gap as best we could to be able to still serve them. Otherwise, they couldn't get, the food stamps they need, the services and keeping kids safe and all the rest. So those are a couple of the things that were just really powerful observations and issues that we really needed to address.
Thank you so much for sharing all of that. Yeah, I to speak to Monica's response, I think part of the conversation is about our rituals around grief and loss and how those change and evolve when we're no longer able to maintain the kind of structure of those rituals in the same way. I've had lots of conversations with people about losing loved ones during this pandemic, and they say, we've got all of these limitations and restrictions, and there were all of these plans put into place before, and this is what my loved one wanted, and it just looks very different and feels very different. So having those conversations with the frontline workers about how for them it lands differently and what do we need to do to support them to change what that feels like so they can still kind of go through those stages of grief and loss, even though it looks very different, because the rituals that we previously depended on are not necessarily able to be carried out in that same way. And Don, I love what you're talking about. I think it's a wonderful opportunity to talk technology access and kind of closing that gap. So whether it's, a socioeconomic issue or even just, I'm thinking of Colorado has some very rural spaces, right? And so it's just a connectivity issue. I go out to certain places in Colorado Springs and my cell phone doesn't work. So my GPS falls off the track. So, and so having those conversations about how do we move forward and change that so that people truly have access to the things that they need to remain independent in their homes and in their communities and have access to healthcare and just kind of the basic necessities. So thank you so much for bringing up those 2 points. I think those are really important points to have conversations about. So along those lines, looking at some of the challenges, we're also going to talk about some of the creative and innovative ways that you both kind of dealt with those challenges. Don, I can't even imagine what it looks like to take all employees and all of a sudden kind of put them in a different space and ask them to do different duties, and what does that look like? So let's talk about some of the creative and innovative ways that your organizations have met some of those needs. Monica, for you, supporting your staff when they're going through some of that grief and loss and mental health stress and strain, and Don, certainly for you and your employees, because you guys have lots and lots of people that you care for and care about, right? They're not just employees, they're family.
Well, actually, interesting you say that, because one of the touch points, if you will, with what Monica said was the concept of taking care of the caregivers. It's how we're making sure they're taken care of. So that has been a big issue for us. A couple of things that we've come up with to address some of those issues that we're talking about. One of them is we created immediately a document runner program where we recognize that there are some people, not only do they not have internet access, but they may not have the experience and skills to deal with it. So we pulled people from areas where they weren't as busy because of this strange dynamic and put them in their car to literally drive around the city and pick up documents and then go back and pick them up after they're filled out, drop them off. And it's just been really a great help to people in the community. So that was one, in some ways, sort of old-fashioned way, if you will, that we addressed that issue. And let me tell you about an interesting kind of positive twist in a new way of doing business that we didn't expect was, I think I mentioned that we also have child welfare protection in our department. And so when you think about how you're going to keep kids safe in this environment, it's challenging. One thing we found was that for a fair number of our clients and the people that we're trying to help, the technology aspect actually helped us, because just for example, teenagers are so used to being on computers and dealing with this stuff, with their thumbs, that when my social workers are interviewing them or talking to them about what might be going on in their family, we're finding that some of them, a lot of them, are more willing to talk to us or communicate with us because this is the tool they're used to. They're not used to some strange adult standing in their living room. That's challenging. This is more natural to them. So that's one of those odd, again, positives, if you will, or learning experiences we've had through this that has been beneficial in a way that we've been able to maneuver through this tough waters and still do our jobs.
And I think that's, just carrying on that point, Donna, I think as far as we talk about caring for our caregivers, we're very fortunate to be part of a larger organization, and we're able to deploy a lot of employee assistance program resources and bring counselors to the facility. And that's always certainly been our traditional approach to offer grief counseling to our line staff. But I think, one of the things that I was most impressed with was the way that our caregivers helped and stood up to take care of their fellow caregivers. We saw staff members, posting and sending words of encouragement to one another, leaving little goodie bags of just, thanks, notes of thanks to their fellow coworkers for being there on the front lines with them. I think, the other piece is we really did leverage our spiritual community and asking them to come in to bring additional resources by, hosting several blessings of the hand ceremonies, which we traditionally host an event like that during Nurses Week. But it was important that we had sort of a reset point for staff members to be able to find a venue where they could express what they were feeling. And then I think what was also amazing to see is the way, going along the terms of the way our team members supported one another. We had staff members really step up because they had personal interests and host conversations about topics that were related to what was going on, and just really serve as kind of a private support group amongst caregivers for one another. So while we brought the traditional resources forward, it's how our team members and leaders sort of adapted those resources really to maximize and leverage what was available to reach as many people as possible in a variety of ways that people needed to be touched and reached.
That's great. I love that. And again, I think what you're speaking to is really being very intentional about the delivery of the pieces that your staff need. And to your point, Don, about what the community needs, right? You're talking about, people getting in cars and driving documents. And I'm thinking about that not only works for a certain segment of the population that doesn't have technology access, but also to a lot of people who are really disabled. Our community members who are blind and deaf and highly physically challenged that don't have that accessibility component to it. So finding those creative solutions, I think, is a really beautiful testimony to how you both kind of care for your community and your staff, and are willing to kind of be innovative and push those boundaries and say, but what about this? Let's talk about that and let's just try it because it just might work. And I think in these kinds of situations, you really see some of the best come out of people. Other workers and colleagues kind of reaching out, leaving notes of generosity, cooking meals. I've heard of lots of conversations of people talking about childcare challenges, especially early on. Monica, for you, when you've got ER docs and they can't call off, or it's just like, what do we do with our kids? I don't have a childcare provider anymore because the childcare resources are closed. Again, I think it's about utilizing that connectivity of community and really seeing people rise to that challenge of generosity, because people are really good at heart. And I think once you build that culture, and I think that's the other thing, Monica, you and Don, I know you both really cultivate a culture of caring and compassion and togetherness. So thank you so much for that. So, all right. So the next question would be, how have you as a leader been able to support staff as they've seen unforeseen challenges? So, Monica, you kind of touched on this briefly, talking about some of the ceremonies that were kind of changed and notes and things like that. But how have you specifically kind of addressed some of those pieces?
I think what's been most important for our entire leadership team is being visible to our team members. And certainly as an organization that is open 7 days a week, 24 hours a day, that is making sure that we're visible and available to all our team members, not just those that we might interact with on a day-to-day basis, Monday through Friday, for instance. So long had been a tradition here at this organization with our team that we would take a day, a month, or more often, depending on what was going on, and come in really on deep nights around 4 a.m. to sit and talk with our night shift. And that was something we were very purposeful and deliberate to continue during the height of our pandemic. You know, El Paso, I think as was previously mentioned, was on the national stage as being the epicenter of the COVID pandemic surge. Now it's somewhat shifted west to Los Angeles. And in those days in November, you know, team members, all of our team members, you know, would be available, you know, in scrubs to you know, all hands on deck, really taking an approach that at that moment, our entire team was here to serve our caregivers, to remove barriers and be a resource to bring whatever it was that they needed to their front line. We obviously had a command center that was established, that we still have in operation, where we were able to relieve from some of our key team members and leaders some of the duties that we could. We repurposed other individuals and other departments to take on those responsibilities. And that worked well just because, you know, it was one less task that someone had to manage that was relieving them to be able to handle the task that was more critical in the patient care areas. But I think, you know, at the end, it's really about management visibility, being able to sit and have a conversation with individuals. And you know, most importantly, is when our individuals or team members do bring up concerns or barriers, that we respond quickly and provide feedback as to what our potential solutions or options are going to be to address their concern and not let it linger unaddressed. And so, you know, we had as simple as it may be, just a whiteboard where concerns were jotted on a daily basis as needs arose. And as an entire leadership team, we would track and hold one another accountable. You know, how are we going about addressing a concern that might be very specific to a particular department? But that kept us all on the same page. And being able to be consistent with our teams and saying, yep, we know that this is an issue we brought forward and this is our plan to address and what the anticipated timeline for resolution might be. But that was helpful, just being present for our staff.
You know, what's interesting is even though our situations are in some ways very different, because I don't think I mentioned that we closed our buildings. We in essence closed. And still are. We only see folks who come in on an emergency basis. So we sent our employees home and we do business totally different. Whereas Monica's got to stay open, you know, it's like the opposite. But what's interesting is there's a common theme that I heard, which is in some ways, try to keep the same things that are working going, keep the same routines or the same important practices going. And that's what we've tried to do. And I think, interestingly, we had an employee engagement survey during this situation, and the results were really positive. And I think it's because we did keep some things going and then even enhance some things. So the supervisors that we have, you know, out of a staff of about 1,200 in our department, have about 200 supervisors, and they got high marks for their engagement with their workers. So it really, you know, when you talk about, oh, make sure you're checking in with your workers. And for some reason, when you're in the office, it probably feels like, well, I saw them today, I don't need to do anything. Whereas now they're taking extra effort to really reach out and have more frequent meetings and conversations. And that's been a big deal. So we saw that in the survey results, which was great. Ironically, well, then the second thing we did is we had to find ways to support these employees in this transition. Support them around both the physical nature, you know, not everybody has an office and not everybody even had a laptop. We had to really be on top of that, but we kind of really got on top of it to get employees what they needed, including the right chair, the right everything. And that led to us having to, how can I say this artfully, sort of push the envelope on city rules here and there, or seek exemptions from what normally would be taboo, let's say. Including scheduling. You know, somebody mentioned, I think it was Dee, you mentioned the issue of kids, people who have children. Well, that, you know, when you're trying to do eligibility work on a computer and there's a child, I mean, that's tough. So we actually got the green light to allow for shift changes for our workers to be able to do their work off the normal time, so they could tend to issues like children because the schools were closed. So that was another important sort of initiative that we took on, which is sort of finding ways to make the rules work for us. And then the last thing, when I say we tried to be sure we kept the routines going, and this sounds maybe trite, if you will, but I think it's been effective, is, you know, I have, I play the guitar, and I love playing, and even playing here and there at the office. And so what we did pretty shortly after the pandemic started is we started a weekly break time where myself and then an employee who may want to join in the fun for 15 minutes or 10 minutes, just get on one of these things, and anybody can get on and hear some music. And it's just, I think that has really helped people feel, you know, that they have a connection, that they're valued, and that it's a safe space to just kind of let everything go for 10 minutes. So that's been kind of fun, and I think has made a difference.
I love that, Dawn. That's awesome.
That's very cool. And I think the what I hear you both speaking to is that intentionality of listening and communicating. And, you know, Dawn, coming from that behavioral health background, you can certainly appreciate that when people are stressed, they're very raw. And so if they don't get some kind of feedback when they communicate immediately, they get even more distressed. And so even Monica, you were talking about the whiteboard, and I thought that's beautiful to, you know, to have them kind of have an outlet and write something down and then be responsive to it and say, I hear you. I don't, you know, we can do this right now, and then we can do the other part later, but I hear you. Because just saying that and being authentic in that space with people takes the tension down, right? People are able to breathe. They're like, okay, leadership hears me. They're not in some ivory tower in silo and untouchable. They're boots on the ground, servant leaders. They're here with me in this moment. And they're recognizing that we're struggling, but they're here struggling alongside us, and they're going to get us the resources, or at least bear witness to some of that. I am a strong proponent of just validating people's feelings and saying, yeah, this is really rough. Mm-hmm. And I'm here with you. So let's be in this together and see how we can make it a little bit better. So thank you so much. Those are really beautiful comments. I appreciate that. So we're going to kind of widen the lens a little bit, so to speak, and talk about what's going on in the greater community. So for you, Dawn, this would be about what are other human service leaders saying? We were talking about earlier that Colorado is a big state, and we've got all kinds of different communities with all kinds of different needs. And for you, Monica, you know, Providence is certainly an incredibly gifted organization, and they are incredibly blessed to have you. And so there are probably other smaller, more rural hospitals, or hospitals that aren't as well equipped, or so let's have that conversation about what are other leaders in your industry saying about some of their challenges, whether it's, you know, economic or technology or accessibility or whatever it is. Let's unpack some of that for a moment.
Dawn, do you want to take this? I think, you know, I'm certainly interested to see how.
Yeah, okay, sure, sounds good. You know, it's interesting because in the whole human service field, as you get outside of cities, the sort of philosophy and principles sort of change. In Denver, I'm just so lucky to work for a mayor who, I mean, Mayor Hancock supports us 1,000%. He's had history in his family of connections to departments. I mean, it's just like, I am just blessed in that way. You get outside of the metro areas in the state, and I'd imagine in the country, and it's a different feel around human services work, you know, what people think of welfare and all that. So I would have to say that one thing I observe in this pandemic is the challenges that some of my colleagues have. We have 64 counties, so 63 other folks who have sort of addressing these issues in that sort of dynamic of a different way of thinking. So that's one thing that I have observed in this pandemic. The other is that some of them are struggling with this concept, and I'll go back to what I said at the beginning, this concept about agency time and having people come into your lobby, because I think that, well, first of all, geographically, it's harder in some ways, but also it's just, it's a different way of thinking about this. And I think they are, so most of my colleagues have their lobbies open and they're having people come in. And so that creates, in my mind anyway, stress on their employees who have to deal with folks face to face, as well as the clients and all that. And I think that is a different dynamic around the state that I know some of my colleagues are grappling with.
Yeah.
You know, I'll just carry on. I think we've been so blessed. I've been so blessed to be part of this organization, NALHE, and have a wide network of healthcare colleagues across both the state of Texas and, you know, broader within Tenet Healthcare across the country, where other individuals experience their surges at different times. You know, we had our own within the family in Detroit that happened earlier in the spring and summer. And colleagues in the Houston market had theirs sort of in the later part. And, you know, what was wonderful is being able to reach across the aisle and sit and talk with those who had experienced it, just to ask, you know, how did you manage this situation? What solutions did you have? And there was such a willingness to share. You know, I had friends and colleagues that would just send, you know, here are the forms, here are some of the algorithms that we use. Which, you know, we want to be able to pay it forward. And I think that was such a blessing that we all had similar challenges. We had a variety of resource limitations depending on, you know, the size of our organization. But I think in the end, you know, when I think and talk to my colleagues across the industry, the challenges were similar. You know, how do we stay engaged with team members? Having, you know, the obvious challenges of not having enough, whatever that enough is, whether it be space or equipment or personnel, but knowing that there were others who had gone through it, who had made it to the other side and were successful, and these were the strategies that they used, I think was such a blessing to be able to have that resource.
That's great. Thank you. So I think especially in the field of healthcare, it can seem really competitive sometimes. And yet what you're talking about is really this willingness to share and say, look, we're in this together. We are only going to get stronger and better if we share our resources and tools. So whether that's some IT person created a dashboard to track all the PPE in the hospital and let you know kind of when things are running low, or, you know, for you, Don, sharing those tools and resources and operating procedures of like, well, this is how you switch to services online, and this is how we can do this differently, and this is how we can kind of flex schedules and have those conversations and still have billable hours and accountability, because, you know, we all have, you know, payer sources that we have to be accountable to, and we want to be respectful of that. But sharing that kind of knowledge that we've gained through experience, so that the next person doesn't have to struggle as much and can then kind of take it and tweak it and make it their own, right? Because I think, you know, Don, you were talking about the different counties and how they all kind of look different, and Monica, all the hospitals kind of look a little bit different and have a different culture and a different cadence. So, you know, giving them the tools and then also giving them the permission to kind of make them their own, and giving them that ownership. So that's great. Thank you. So what are some common themes that you've seen arise across either the counties or different areas in gaps in services? So we talked a lot about how a lot of what we're seeing in this pandemic and really in this country was there to begin with. It's just that the pandemic kind of shined a spotlight on it and made it a lot more visible. So those gaps maybe not necessarily widened, they might have widened a little bit, but definitely became more visible in whatever form that was. So what are some kind of common themes that you're hearing in your industry about, like, things that you were like, oh, we really need to get ahead of this?
I'll take a crack. The one that really came to mind first was childcare. What's interesting is that issue is a common issue across all of our work and impacts both clients and our own staff. Childcare has been one of those issues across the state that really created both really big challenges for folks, but also made us really think out of the box on what we might be able to do. As I mentioned earlier, one of our kind of crazy strategies of moving the workday time schedule. So that was one that came to mind that really commanded every department to really think about how they would both serve the people who have that need when those childcare providers were struggling. You know, that was an issue there. And then how do we support our employees in that dynamic? So that's kind of one that is is a universal challenge for us.
I certainly don't disagree, because I think you know, we have a young workforce that we're trying to manage, and then I think the other piece that put pressure on our team members is the online schooling, like you were mentioning. You know, trying to do eligibility with a small child as we're trying to educate them, and getting the first grade certainly is a challenge. I think, you know, from the healthcare system side, I think there were gaps in, you know, what access our community had to resources. The resources available in the inpatient facilities were certainly there for them when their condition arose that they needed to access. But, you know, we saw early on, and this is certainly as governments and communities were trying to gear up to respond, is making sure that there was adequate testing available. And that was just, you know, a universal challenge that we all had to sort of work through. And we know that enough testing is never enough. That certainly, and we're seeing a little bit of that now with vaccination, where we have certainly a lot of folks interested, but, you know, we're still not yet completely, the vaccination program hasn't yet completely rolled out down to the general public level, right? So I think, you know, kind of working with our community partners and being able to serve as a resource of information of where to be able to better access or direct individuals where to go about getting resources, that wasn't something that would be typically at that level that they needed to access the healthcare system. But, you know, they figured hospitals certainly are trusted voices in our community, and being able to sort of fill the gap and being able to carry the messages to where they would be able to get testing in a prompt fashion, and so on and so forth.
Yeah, that's great. Thank you. I appreciate that. I think what I hear you both speaking to is kind of those social determinants of health, and coming from a public health background, it's a phrase that I'm very familiar with, but I think this pandemic has really allowed us to see the interconnectivity of all of it. Dawn, you know, between housing and food access and transportation. I mean, oftentimes I was watching a lot of the videos of people going and doing, you know, COVID testing in their cars. And I thought, yeah, but what if you don't have a car? You know, what if you're in rural Colorado or rural Texas and there are no buses? You know, how do you get tested? Where does that happen? So, you know, really looking at that kind of interconnectivity that of all of those systems converging on health, creating a healthy community, and sustaining a healthy community and allowing that community to thrive is really important. So thank you so much. I really appreciate that. Yeah, definitely childcare. I mean, I think that's a conversation that we can continue to have for a long, long time about, really from a legislative standpoint, like how do we use this as an inflection point to help motivate those people on you know, on the legislative side to really start revisiting, because it's been a conversation, you know, since the Nixon era, right? You know, we were having conversations about universal childcare and what does that look like, and who pays for that, and what kind of systems are in place so that you have some kind of continuity, because I think that's the other part of it. Some child cares are better than others, and how do we have some kind of consistency and continuity and safety for our littlest and most vulnerable members of our community. So
well, I don't want to deviate too far, but it also is calling to mind the role of women in this society, and how in some ways it hasn't changed much with the women as primary caregivers, even when you all are working full time. I've got, I think 80% of my staff is women. And so I'm very in tune with how that issue and that dynamic impacts the women in my department very differently. And it's calling into question some really interesting challenges of maybe how much more we have to do to make this really a society that walks the talk of equality. So I don't want to get too far off.
yeah, no, absolutely.
It plays right into that issue.
Yep, for sure. So the next two questions I'm going to kind of break out, and I'm going to do one for Dawn and then one for Monica. So Dawn, one of the themes is human together. So I wanted you to kind of elaborate on how that theme has kind of been brought to fruition throughout the entirety of this pandemic that we've experienced.
You bet. You bet. Well, human together is it's more than our strategic vision, is really a philosophy that we're working to really live and breathe, which is that human service departments need to do more than just be there for the really vital, essential services. The question is, what can we do to make a healthier community and address some of the reasons why people even have to come into our departments? So we adopted this about 3 years ago, this human together vision of trying to play that grander role. Not easy, really hard. Talk about social determinants of health. This is sort of social determinants of being healthy and happy. How we are sort of addressing and moving that conversation forward in the midst of this pandemic is really fascinating, in part because the pandemic is really pointing out in stark relief where there are those issues in our society that really need to be addressed, where poverty rears its ugly head in a way that says, wow, where race issues rear their head around what's been going on, and how those kinds of issues need to be addressed. So one thing it's done is it's sort of made the roadmap of what issues we need to be addressed much more clear for us in some strange way because of this pandemic. So that's one way that human together has sort of breathed life during this pandemic. The other is to have us work with our partners, our non-governmental partners especially, more closely, because as you think about issues like, let's say, wage equity, if you will, we're not the department that's going to get in the middle of that debate, but we certainly can be a strong partner with those that are in the middle of that debate to provide information about what happens if there isn't wage equity. Here's how much we have to pay as a government to deal with the fact that people aren't paid enough. All those kind of issues we are working with partners to be involved in, and I think that has been sort of a silver lining, if you will, around this pandemic, around human together. It has really sort of shown us that we've got work to do. It's important work, and it will make a difference. And so, I just hired a new deputy a month ago who is fully dedicated to our community impact, and she's going to be phenomenal. And I think, again, some ways the pandemic allowed me a wider opening to take that action, and the mayor and council have been very supportive of that effort.
That's great. Thank you so much for sharing that. So Monica, to you, I think one of the things that's been really fascinating to me is some of the ethical questions that have arisen as a result of the pandemic. And as I was navigating and talking to other doctors and healthcare leaders, the conversation was, who makes these decisions when resources are finite? And these are conversations that are really challenging to navigate with your staff, because your staff wants to do the best for everybody that comes under their care, and yet sometimes we're faced with real limitations. And so, having those conversations with the staff, the family members, and the patients on the other side, and really talking about informed consent, what are their wishes, how do we allocate those resources, who's making those decisions, and the information I kept, that's for the leadership to decide. And I thought, oh, my stars and stripes. So Monica, as a CEO, how have you kind of navigated some of those really more challenging ethical pieces? Because certainly El Paso was hit very hard, and there were probably some really difficult conversations to have. So if you could just kind of walk me through some of that process.
Yeah, and I'll start off by saying I'm incredibly blessed to work with a dedicated and devoted medical staff that has been part of our response and journey since the first day we admitted our first COVID patient back in March, and through our surge that we just kind of came out of in November, December. And why I say I'm blessed is because as an administrator, I'm a non-clinician. I am in no way in any position to be able to make those decisions. It's really in collaboration with our medical staff. And early on, we established sort of a physician committee, as you were, those that were sort of leading our ICU provider group, our hospitalist group, our emergency room group. And so we had a variety of other specialists, infectious disease, that came together, and we were having weekly conversations about new treatment options that were being offered. When remdesivir came, there were certain qualifications as to who could qualify for that treatment, and so on and so forth. So I was very fortunate that those decisions weren't left to an administrative suite. It was really in collaboration with the physicians. I think the other piece here in El Paso that we were very blessed is both our organization, Tenet in broad form, as well as the state, deployed additional resources. So, we had the insight of having experienced surges in other parts of the state and other parts of our company to know what we likely were going to need, whether that was human personnel, equipment, alternative care site locations, and how to outfit alternative care site locations to convert spaces that weren't traditionally used for inpatient care in order to be able to care for patients safely. And so those resources deployed upon us in sort of a massive response back in October. And so we felt, going through our response, that we had resources available, although perhaps we were using alternative care sites that we otherwise wouldn't think, we were boarding, as many other hospitals were having to board patients in the emergency room. But we had all the resources and all the care, inpatient nurses and the equipment and personnel necessary to be able to safely take care of patients in those alternative care sites, which didn't force any caregiver or physician to have to make a decision about who got, who didn't get. Our state also established an alternative care site here in our community, and really being able to then appropriately identify patients that might need that next level of care. So, the hospitals were reserved for your most critical and sickest, and yet alternative care site was available to continue to allow a patient to proceed with their recovery in a space that they didn't otherwise necessarily need all of the resources that a hospital might be able to bear onto them at that moment. So I'm very fortunate. I know that other colleagues across the country may not have been in the same situation in responding to their surge. But I do think we had the great fortune of having others gone before us to be able to know, here's what you need. And we received all of that support and resources and a medical staff that was really dedicated. I think one of the last things that I'll add that really was what we needed a constant presence of is the medical staff really stepping in to have those conversations, back to the rituals. And these weren't necessarily the anticipated plans for my loved one as they approach their last days, and having physicians available to really help guide that conversation with families was one that we had to deploy more concentrated effort and resources towards, because again, I think you said it best, DeAnna, this wasn't the plan. This wasn't the plan for us, for grandma or what. And our medical staff really being able to help families cope with the prognosis and the outcome or the recovery plan or the treatment plan that might follow.
Great, thank you so much. That's amazing, and I'm so glad that you were supported in that way. You're right. It's a tremendous blessing to have that level of support and kind of resources to kind of draw from. So that's great. We're going to kind of shift a little bit and talk a little bit about some of the dollars, right? So when we talk about funding streams, I think conversation was the switch of telehealth and reimbursement models and what was allowed in telehealth and what wasn't. Don, to you, looking at kind of that flex schedule for employees and some of the reimbursement and some of the dollars, because even though a lot of the work that is done is kind of counter-cyclical. The other conversation is that a lot of the dollars that human service departments are drawing from comes from the county in which they're embedded. So when people stop buying, when incoming cash flow is different than it usually is, that impacts the dollars that are available. So if you guys could just kind of speak to some of the financial pieces and some of the challenges or some of the creative streams that you've been able to tap into.
Creative streams, I like that. When you're in government, you got to be careful with creative streams. Well, let me say that I will start with the fact that my predecessor, who is still working for the city as a deputy with the mayor, but who lived through the last economic crisis, and it wasn't pretty at all in the 08, 9, 10 timeframe. Really took it upon herself to start creating a savings account, if you will, for our department. And when I took over almost 6 years ago now, I kept that attitude going that we needed to have a savings account. So I'll start with the premise that we have a pretty healthy fund balance, that it isn't limitless, but it sure is allowing us to be there during this counter-cyclical dynamic that you mentioned, so that we not only don't have to lay people off like they did back then, but we actually are, I think, one of the only agencies that is actually hiring people to take care of folks. So, I mean, we can't continue to do that forever, but feel pretty good that we can do it for a while. Number two, it's been really heartwarming that really from the federal Human Service Department down, it's been amazing how supportive they've been of our work. I've been in some ways pleasantly surprised because, as you say, even the state government is challenged with revenues, but they see how important this work is in this dynamic, and how many more people we're serving who never needed human services benefits before, and now they're needing them. And so whether it's unemployment, which of course is the state system, or whether it's SNAP/food stamp benefits, they see that as vital. So we've had pretty good luck with either the proactive monies that are coming in or no cuts, fewer cuts than you might otherwise anticipate. So I guess the sum total of everything is, and I guess I didn't get to your creative question. Unquestionably, we have been able to sort of shift monies from one bucket to another, do different things like that to help us weather the storm as well, and have been creative in a perfectly above board way. But I think the sum total of it all is that we've done pretty well to be able to continue to serve people. And again, I think that one thing Monica and I have both mentioned that comes out loud and clear to my ear is the support we have from our leaders to do that kind of work and to be able to continue to serve.
Donna, I think just like you mentioned, being able to, whether it has slush fund or move resources from one priority to another, I think we've also benefited very much in that same way, being part of a larger integrated organization and network of hospitals and broader health system. You obviously have that scale that lets us be able to manage and weather through this situation. But healthcare has always been one that has had to respond to surges and slumps in volume. And I think, not in a creative way, but in a responsible way, we had to adjust and adapt, whether that be our staffing when the volumes just simply weren't there. The responsible thing was to adjust appropriately. And I think that's something that we continue to do and watch. And when the first lockdown happened, I know several community, our community members were frightened to come to the hospital, even for necessary non-COVID related care. We saw our volumes dropping. So, just as we have done in the past, we adjust all of our resources to be in line with what we are taking care of. And certainly, we work with several small businesses in the sense of our private independent physicians here. Most of our physicians own their own small business, have their own employees that they're responsible for. And just being able to support them as they adapted their practices to be able to adjust, as you were saying, to the telehealth options, and to allow them to continue to be able to serve our community was very important, because we needed to make sure that they stayed available to serve our community through this sort of unknown period.
Oh, that's great. Thank you so much. So we're just kind of winding down the conversation. And so any last remarks, anything that either of you would like to share with the audience, whatever it is?
I'll just close in saying, as I started, this is an incredible privilege to be part of this conversation. And I know this will be an experience that I'll look back on, and we all will as caregivers during this response, and really be amazed by the creativity and the compassion that all that work with our patients exhibited during this experience. So it has been a true blessing, having a great, team that I work with, leadership team that supports me, and a medical staff that really was there with us, having to make difficult decisions or decisions in the absence of all information. So I appreciate having the opportunity to sit in this conversation with you, Dawn, and the good work that you're doing on the outside. And I consider the work we're doing on the inside. So thank you for hosting this and beginning this conversation.
Well, and I'll take that baton and say you're very welcome, and it's an honor to have been on the panel with you, Monica. I would start by saying that most of the listeners to this are from the healthcare or health industry or in that world. And one thing we share, I think, is that people in our business and your business, are passionate about helping people. And it is so, it's so much better to start with that as your premise. Your foundation is that people are there to serve. And what a great place to be. So for everyone who's in this business, I appreciate all that you all do who are listening to this and watching this panel. I would also say that, the organization, I've been in my career involved in lots of Latino organizations here and there. And I think there's such value in coming together and sharing ideas, stories, shoulders to cry on, people to cheer with, the whole gamut. And so, I think it's great that you all have this association and this partnership and familia that allows you to have that. And I can tell from what I'm hearing that the future is bright with Monica leading the charge here. It'll be a great couple of years. And so thanks for doing this, and thanks for still looking to come to Denver. I look forward to personally welcoming you. I hope that we're in a position we can do this live and in person, and if not, we'll do however it is, and I'll be happy to help and participate however I can.
Perfect. Thank you so much. I really appreciate that. All right. So then we will just kind of close it down and say that I would like to invite you and kind of everyone else. Ro, is there something you wanted to, these are your slides.
Oh, thank you. I just want to thank you, DeAnna, for moderating such an incredible conversation. I want to thank you, Dawn and Monica, for the insight and for sharing. And I agree, I think having a platform to speak on behalf of the work of others is also great. But you two are incredible leaders in this space, and we are blessed to have had you both join us today and share with our familia and our partners the information that you have shared. So this has been wonderful. More of this to come, I think, for all of those who are listening. As Dawn mentioned, I really do wish that we have an opportunity to meet both Monica. Well, I have met Monica quite a few times in person, but Dawn at least in person, and meet each other in person. As you know, is an incredibly important thing to do as a Latino person. And so that is what our network represents. It's about coming together. We are, as I mentioned here on this, a diverse group of healthcare professionals and aspiring healthcare leaders, from students to people exploring the industry that are just sharing wisdom, giving insight, and sharing experiences. And so we have an incredibly a diverse leadership board from across various different health systems. So we invite you to learn more about NALHE. And to this here, let's just get to work, right? And join us. And NALHE Adelante is what we usually close off with. Visit us on our website. And also, I'd like to give praise and thanks and recognize the NALHE Task Force on the COVID-19 pandemic that created an incredible landing page of curated resources and links that are following also this COVID pandemic. And there's amazing data on nalhe.org/coronavirus. So thank you, DeAnna. And I think with that, we will end our session. Have a blessed day. Keep safe, wear your mask. And we will continue this conversation with session 2 next month. So more to come. Thank you all.
Great. Thank you so much. Have a great day.
Stay safe, Ro.
Absolutely. Thank you. Yes, I will.
I know. I was going to send you a note to say now we traded. Now you're the hot spot.
I know. Yeah, I'll be calling you to get some models and exploration pieces there.
Don, I'm ready to come to Denver. So let's
Love to have you. Love to have
get it done.
We'll keep our fingers crossed.
Yeah.
Yes.
Yeah, congratulations on all you've done.
Oh, no, thank you guys. This was a lot of fun. I appreciate it. And very nicely done, DeAnna. Really.
Well, thank you so much. This was a true joy. I really, really appreciate you guys coming on, and this was great. This is a good start. We're off to a good start.
Awesome. All right, guys,
Thank you.
take care. Happy
Thanks.
New Year.
Bye-bye.
Bye-bye.
You all take care. Bye.